All right, so today we're doing a deep dive into Meropenem Vaborbactam.
Sounds good.
It's a combo antibiotic.
Right.
And it's making kind of big waves, I guess you could say, in the treatment of some, some really tough bacterial infections.
Some tough ones.
We're going to be focusing on its role as a reserve antibiotic,
right,
as laid out by the World Health Organization in their AWARE book.
Okay.
AWARE stands for Access, Watch, and Reserve.
Got it.
It's a framework for classifying and managing antibiotics to fight resistance.
Okay.
And you, as a medical microbiologist, you deal with these challenges every day.
Every day.
So get ready to explore how this drug works and why it's reserved for those critical cases where it can really make a difference.
Exactly. This isn't your, your everyday run-of-the-mill antibiotic. This is a powerful tool that we need to use carefully and strategically to make sure it remains effective when we need it most.
Exactly. So to kick things off, let's just break down what Meropenem Vaborbactam is.
Right.
What are we dealing with?
So it's a dynamic duo at its core.
Okay.
Meropenem, which is a carbapenem antibiotic known for its broad spectrum activity, and Vaborbactam, which is a beta-lactamase inhibitor.
Okay, so a team effort.
Team effort.
But why is this combination so special? What makes it stand out from other antibiotics?
So think of it this way.
Okay.
Meropenem is like a skilled warrior going in to disrupt the formation of bacterial cell walls, essentially stopping those bacteria in their tracks.
Okay.
But some bacteria have developed these sneaky defense mechanisms, enzymes called beta-lactamases, that can break down meropenem, making it ineffective.
Yeah.
So that's where Vaborbactam steps in. So it's like Vaborbactam is meropenem's trusty shield, protecting it from those bacterial attacks.
Exactly. Vaborbactam swoops in and inhibits those specific beta-lactamases that wouldn't normally break down meropenem. It's particularly effective against certain types, like those belonging to Ambler classes A, C, and D. By blocking those enzymes, it allows meropenem to reach its target and do its job effectively.
That's incredibly clever.
It is.
It's like a carefully choreographed attack plan.
Yeah.
But I'm guessing it's not effective against all bacteria, right?
You're right. You're right.
Yeah.
No antibiotic is a magic bullet.
Of course,
While Meropenem Vaborbactam is powerful, it does have its limitations.
Sure.
It's important to remember that it's not effective against bacteria that produce metallobeta-lactamases, like NDM, DIM, and IMP, or OXA48.
Got it.
These enzymes have different mechanisms
that Vaborbactam can't inhibit.
So it's a targeted weapon, effective against certain types of resistance, but not all.
Correct.
This highlights the crucial role of the medical microbiologist.
Absolutely.
Yeah. You're the ones who identify those specific resistance mechanisms. Helping to guide clinicians towards the most effective treatment.
Couldn't agree more.
Yeah.
Knowing the local epidemiology of resistance patterns is absolutely vital for making those informed decisions.
For sure.
If you know which resistance mechanisms are prevalent in your region, you can anticipate whether Meropenem Vaborbactam is likely to be effective or if you need to consider alternative options.
Okay. So this brings us to the big question.
Okay.
When does Meropenem Vaborbactam actually come into play?
Right.
The WHO has classified it as a reserve antibiotic. And I'm curious to know what that means. In practical terms. For a medical microbiologist like yourself, when would you recommend pulling out this powerful weapon?
Well, so think of reserve antibiotics as a precious resource, something you want to protect and preserve for those crucial moments when you truly need them. We reserve them for specific situations where other antibiotics have failed or are unsuitable. The WHO's AWARE guidelines highlight a few key scenarios where Meropenem Vaborbactam might be the best or even the only choice.
Okay, let's break down those scenarios.
Okay.
What are some specific situations where Meropenem Vaborbactam might be the answer?
One of the main scenarios is the targeted treatment of severe infections caused by those KPC-producing Enterobacterales we discussed earlier. These bacteria can be particularly challenging to treat because they're often resistant to multiple antibiotics.
So if you've tried other options, like ceftazidime avibactam, and the bacteria are still putting up a fight, Meropenem Vaborbactam might be the next line of defense.
Precisely. But it's not just about the bacteria itself. It's also about the specific type of KPC it's producing. There can be variations in resistance mechanisms, even within those KPC-producing bacteria. That's why those detailed microbiology reports are so crucial. You need that granular level of information to guide the clinician towards the most effective treatment.
So it's not just a one-size-fits-all approach.
No.
You need that specific information.
Oh, exactly.
But the resistance profile. To make sure you're hitting the target.
Correct.
Now let's talk about those situations where you might use Meropenem Vaborbactam even before you have definitive lab results. What's the rationale behind that?
You're talking about empiric use, and it's typically reserved for those high-stakes situations where a patient is critically ill and you have a strong suspicion of a multidrug-resistant infection. For instance, if a patient comes in with severe sepsis or septic shock, and you have reason to believe it might be caused by a carbapenem-resistant bacteria, you can't always wait for those lab results.
You got to act fast.
Exactly. You need to act quickly.
So it's about balancing the potential benefits of early treatment against the risks of using a reserve antibiotic without definitive confirmation.
Correct.
But even in those urgent situations, you're not just, throwing a dart at a board.
Absolutely not.
You still need to consider all the available information. The patient's history. Any prior antibiotic exposures. The local resistance patterns in your hospital or region. It's all about weighing those factors and making the most informed decision possible.
That's right.
It sounds like there's a lot of careful consideration that goes into every decision when it comes to using Meropenem Vaborbactam.
Absolutely.
It's not a drug you take lightly.
You got that right. And even if you do start with Meropenem Vaborbactam empirically, you need to be ready to adjust the treatment. Once those microbiology results come back, that close communication between the clinician and the microbiologist is absolutely essential.
It's a team effort.
It is.
Working together to fight those tough infections.
Exactly.
So we've talked about when you might use Meropenem Vaborbactam. But what about how it's actually given?
So Meropenem Vaborbactam is administered intravenously, usually over a period of 3 hours.
So it's a direct route into the bloodstream.
It is,
And what's the typical dosage for adults?
For adults with normal renal function, the standard dosage is 2.5 grams of meropenem and 250 milligrams of vaborbactam, given every 8 hours.
So it's a regular regimen.
It is.
Ensuring a consistent level of the drug.
That's right.
In the system. But what about those patients with kidney problems? Do you need to adjust the dosage?
Absolutely. Since the kidneys are the primary route of elimination for both meropenem and vaborbactam, you need to adjust the dosage based on the patient's kidney function. This is crucial to avoid potential toxicity and ensure the drug is being cleared effectively.
That makes perfect sense.
It does.
Now, we've talked about the drug's effectiveness. But what about potential downsides? Are there any side effects?
So the good news is Meropenem Vaborbactam is generally well tolerated. The side effects are similar to those seen with meropenem alone, such as gastrointestinal issues, skin rashes, or allergic reactions.
So nothing out of the ordinary?
No.
Compared to other carbapenems? But given its classification as a reserve antibiotic, I'm curious about its impact on the kidneys. Is it any gentler than other last resort options?
That's a great question.
Yeah.
And it's an important consideration.
Mm.
Meropenem Vaborbactam is actually less damaging to the kidneys compared to some other last resort antibiotics used against resistant bacteria.
Interesting.
This is a significant advantage, especially when you're dealing with patients who might already have compromised renal function.
That's reassuring to know.
It is.
Yeah, it gives clinicians more flexibility and peace of mind.
Yes.
When choosing the best treatment option.
Absolutely.
Especially for those critically ill patients.
Exactly.
Now, you've mentioned those detailed microbiology reports a couple of times.
Right.
Highlighting their importance in making informed decisions.
Yes.
About Meropenem Vaborbactam.
Mm-hmm.
Let's delve a little deeper into that.
Okay.
What specific microbiology tests are essential when considering this drug?
Well, the foundation is always a culture and sensitivity test.
Okay.
This tells you what bacteria are causing the infection and which antibiotics it's susceptible to.
Yeah.
But with Meropenem Vaborbactam, we need to go a step further.
What do you mean by a step further?
We need to pinpoint the exact mechanism of resistance.
Yeah.
Remember, Vaborbactam only inhibits certain types of beta-lactamase.
Yeah.
So if a bacteria tests resistant to meropenem alone, we need to know if it's producing a beta-lactamase that Vaborbactam can actually inhibit.
So it's not enough to just know it's resistant to meropenem.
No.
You need to understand why it's resistant.
Exactly. This might involve additional tests, like PCR or molecular methods, to identify the specific beta-lactamase genes present.
Got it.
For example, if we detect the presence of a KPC gene, we can be fairly confident that Meropenem Vaborbactam will be effective.
Okay.
Because Vaborbactam is a potent inhibitor of KPC enzymes.
That makes perfect sense.
It does.
It's all about getting that detailed picture of the enemy, understanding their defenses so you can deploy the right weapon.
Exactly. And this is where the expertise of a medical microbiologist is truly invaluable.
Absolutely. You're the detectives.
Yeah.
Piecing together the clues and providing those crucial insights that guide treatment decisions.
That's right.
Now, before we wrap up this part of our deep dive, I'd love to get your perspective on the evolving landscape of antibiotic resistance.
Right.
We know that bacteria are constantly adapting.
They are.
Yeah.
Always.
Finding new ways to outsmart our drugs.
Exactly.
What are some emerging resistance trends that you're seeing with Meropenem Vaborbactam?
Okay.
Even though it's still relatively new on the scene.
That's a great question.
Yeah.
And it's something we need to be constantly vigilant about.
Right.
While resistance to Meropenem Vaborbactam is currently rare, we are starting to see some concerning trends.
Okay, like what?
One area to watch closely is the emergence of resistance in certain types of Enterobacterales, particularly Klebsiella pneumonia.
So those KPC-producing bacteria that we've been discussing, they might be finding new ways to evade even this powerful combination.
That's the concern. One mechanism we're seeing is the acquisition of additional beta-lactamase genes beyond just KPC.
So they're essentially stacking their defenses.
Exactly.
Yeah.
Equipping themselves with multiple weapons.
Right.
For example, some KPC-producing bacteria are now also acquiring metallo-beta-lactamase genes, like NDM.
So they're becoming resistant to both Meropenem and Vaborbactam.
That's right.
That's a worrying development.
It certainly is.
Yeah.
It highlights the importance of ongoing surveillance and the need for new antibiotics that can target these emerging resistance mechanisms.
So it's an ongoing battle.
It is.
Constant race to stay ahead of those evolving bacteria.
It is.
And it underscores the importance of using Meropenem Vaborbactam responsibly.
Absolutely.
Yeah.
Preserving its effectiveness for as long as possible.
Couldn't agree more. It's about stewardship.
Yes, it is.
Making sure we use these powerful tools wisely and strategically to protect both individual patients and the future of antibiotic therapy as a whole.
Well said.
Welcome back. So we've been exploring Meropenem Vaborbactam, this powerful weapon in the fight against resistant bacteria.
Yeah.
And before the break, we were discussing some of those emerging resistance trends.
Yes.
Which really highlight the importance of using this drug strategically.
Absolutely.
But I know you, as a medical microbiologist, you're always eager for those real-world examples.
Yes, yes.
You know, those cases where you see the science in action.
Exactly.
So let's dive into some case studies that illustrate the impact of Meropenem Vaborbactam.
Excellent idea.
Yeah.
Case studies are a fantastic way to bridge that gap between theory and practice.
Exactly.
They bring those complex concepts to life and demonstrate how they play out in real patient scenarios.
Exactly. So let's imagine a patient, a 65-year-old woman who's admitted to the hospital with a complicated urinary tract infection. She has a history of recurrent UTIs and has received multiple courses of antibiotics in the past. Her urine culture reveals Klebsiella pneumonia. But it's resistant to several commonly used antibiotics, including ceftriaxone and ciprofloxacin.
So right away, we're dealing with a patient who's at higher risk for a multidrug-resistant infection. The history of recurrent UTIs and prior antibiotic exposures are red flags.
And the fact that it's Klebsiella pneumonia adds another layer of complexity.
Absolutely.
We know that Klebsiella species, particularly Klebsiella pneumonia, have a knack for developing resistance.
Yes, they do.
Especially to carbapenems.
You're absolutely right.
They've got a remarkable ability to acquire and spread resistance genes, making them a formidable opponent.
So in this scenario, with a multidrug-resistant Klebsiella pneumonia causing a complicated UTI, would Meropenem Vaborbactam be a reasonable treatment option?
It definitely could be. But we need more information. Remember, Vaborbactam is only effective against certain types of beta-lactamases. We need to know if this particular Klebsiella pneumonia is producing a beta-lactamase that Vaborbactam can actually inhibit.
So we need to go beyond the standard culture and sensitivity report.
We do.
We need those detailed microbiology tests to pinpoint the exact mechanism of resistance.
Precisely.
So in this case, you'd want to perform additional tests to look for the presence of
specific beta-lactamase genes, particularly those that encode KPC enzymes.
Exactly.
So if you find that this Klebsiella pneumonia is indeed producing a KPC enzyme, you'd feel confident.
I would.
That Meropenem Vaborbactam would be an effective treatment.
Exactly. Vaborbactam is a potent inhibitor of KPC enzymes. So the combination therapy would likely be successful in overcoming the resistance and clearing the infection.
That's fantastic.
It is.
It's like having a secret weapon that can disarm those resistant bacteria.
Absolutely.
But let's switch gears a bit and imagine a different scenario. Let's say we have a 40-year-old man who's admitted to the ICU with severe pneumonia. He has a history of intravenous drug use and has developed sepsis, a life-threatening complication of infection. His blood cultures are growing gram-negative rods. But you're still waiting for definitive identification and susceptibility results.
This is a high-stakes situation. We're dealing with a critically ill patient with sepsis. And time is of the essence. We need to initiate empiric antibiotic therapy while we're waiting for those lab results.
So would Meropenem Vaborbactam be a reasonable choice for empiric therapy in this case?
It's certainly a possibility, especially given the severity of the infection and the high risk for multi-drug resistance. But remember, empiric therapy is always a balancing act. You're trying to cover the most likely pathogens while minimizing the risk of selecting for further resistance.
So what factors would you consider?
So first and foremost, you need to assess the local epidemiology of resistance patterns. If your hospital or region has a high prevalence of metallo-beta-lactamase producers, then Meropenem Vaborbactam might not be the best choice, even empirically.
Right, because those metallo-beta-lactamases are not inhibited by Vaborbactam.
That's right.
You'd essentially be exposing those bacteria to meropenem without the protection of Vaborbactam.
Exactly.
Potentially driving further resistance.
Yes.
But if the local epidemiology suggests that KPC-producing Enterobacterales are more prevalent then Meropenem Vaborbactam would be a more reasonable empiric choice.
Empiric choice.
So you're gathering intelligence.
Yes.
Using that local data
Correct.
To make an informed decision.
Precisely, you also need to consider the patient's individual risk factors. Intravenous drug use is a major risk factor for multi-drug-resistant infections, including those caused by Pseudomonas aeruginosa.
And Pseudomonas aeruginosa is notorious.
It is.
For its intrinsic resistance mechanisms and its ability to acquire additional resistance genes. It's a tough one to crack.
That's why it's important to factor in the patient's history and risk factors when choosing empiric therapy.
So it sounds like there's no easy answer when it comes to empiric therapy. It's all about weighing those various factors and making the best judgment call. Based on the available information.
Exactly. And even if you do start with Meropenem Vaborbactam empirically, you need to be ready to adjust the treatment once those microbiology results come back.
Right. It's not a set it and forget it approach.
A set it and forget it approach.
You need to be constantly
reassessing
and adapting. Based on the new information that emerges.
Couldn't agree more. That close collaboration between the clinician and the microbiologist is crucial throughout the entire course of treatment.
Speaking of that collaboration, let's talk about the role of the medical microbiologist in guiding the use of Meropenem Vaborbactam. It's not just about identifying those resistant bacteria, right?
Absolutely not. The role of the microbiologist is multifaceted. You're not only identifying those resistant bacteria, but you're also providing critical information about their susceptibility patterns. Guiding
the clinician toward the most appropriate antibiotic choice.
So you're the expert consultant providing that specialized knowledge that helps clinicians navigate this complex world
of
antibiotic resistance.
It is.
You're also playing a key role in infection control efforts, helping to prevent the spread of these resistant bacteria within the hospital and the community. Right, because every time we use an antibiotic, we're essentially applying selective pressure that can drive the evolution of resistance.
It's like a constant arms race. And we need to be strategic about how we deploy our weapons.
Couldn't agree more.
Yes.
And this is where the concept of antibiotic stewardship comes in. Okay, let's break down antibiotic stewardship.
What exactly does that involve?
It's all about using antibiotics judiciously. Making sure we're using the right drug at the right dose for the right duration. And only when it's truly necessary. It's about protecting these precious resources and ensuring their effectiveness for future generations.
So it's not just about treating the individual patient in front of you.
The individual patient.
But also
about
the broader implications for the future of antibiotic therapy as a whole.
Exactly. It's a global responsibility.
Wow.
And medical microbiologists are at the forefront of this effort.
Well said. Now, we've touched upon some of the nuances of Meropenem Vaborbactam's use. But let's go even deeper into the specifics. What are some practical considerations when it comes to administering this drug? Things that our listeners should be aware of.
That's a great question. One important consideration is the route of administration. Meropenem Vaborbactam is given intravenously, usually over a period of 3 hours.
So it's a direct route into the bloodstream.
Usually the bloodstream.
And what about the dosage? We mentioned this standard adult dosage. Earlier. But are there any special considerations based on the type of infection or the patient? individual characteristics.
Absolutely.
Okay.
While the standard adult dosage is 2.5 grams of meropenem and 250 milligrams of vaborbactam every 8 hours, there are situations where you might need to adjust the dosage.
Like when?
For example, if you're treating a severe infection, like sepsis, or if the patient has impaired kidney function, you might need to increase the dose or adjust the dosing interval.
So it's not a one-size-fits-all approach?
One size fits all.
You need to tailor the dosage.
You do.
To the individual patient.
To the individual patient.
In the specific clinical scenario.
To specific clinical scenario.
Exactly. And it's crucial to monitor the patient closely for any potential adverse effects.
Potential adverse effects.
Speaking of adverse effects, we discussed general side effects earlier.
General side effects, but...
Are there any specific toxicities or complications that medical microbiologists should be aware of?
While Meropenem Vaborbactam is generally well tolerated, there are some potential adverse effects that we need to be mindful of.
Okay, like what?
One concern is the potential for seizures, especially in patients with a history of seizures or central nervous system disorders.
So it's something to flag for the treating clinician.
Absolutely.
Especially if the patient has any underlying neurological conditions.
Absolutely. Another potential adverse effect is Clostridioides difficile infection or C. diff. Which can occur with any antibiotic use, including Meropenem Vaborbactam.
Ah, that's a reminder.
It is.
That even though we're focusing on these resistant gram-negative bacteria, we can't forget about the potential for other opportunistic infections to emerge.
Exactly.
It's all about maintaining that balance. Within the gut microbiome.
Now, we've talked extensively about the clinical aspects
of Meropenem Vaborbactam. But I think it's also fascinating to
It
delve into the science behind how this drug actually works. What can you tell us about?
So pharmacodynamics and pharmacokinetics.
That's a great point.
It is.
Understanding how the drug behaves inside the body is crucial for optimizing its use. So let's start with pharmacodynamics. Which is all about how the drug interacts with its target. So in the case of Meropenem Vaborbactam. We're talking about how it targets those bacterial cell walls. And how Vaborbactam protects meropenem from those beta-lactamases.
Exactly. So
meropenem, as we discussed. It's a beta-lactam antibiotic.
Beta-lactam antibiotic.
It works by binding to
penicillin-binding proteins.
Are
enzymes involved in the synthesis of bacterial cell walls. By inhibiting these enzymes.
Meropenem
disrupts formation of the cell wall,
ultimately leading to
bacterial death.
So
it's like sabotaging the construction. Those bacterial fortresses. Making them vulnerable to attack. That's a great analogy.
Now the problem is that some bacteria have evolved these beta-lactamases, which are enzymes that can break down beta-lactam antibiotics, like meropenem.
And that's where
Vaborbactam steps in.
It's a beta-lactamase inhibitor, meaning it binds to those beta-lactamases and prevents them from breaking down meropenem.
So it's like Vaborbactam is shielding meropenem, allowing it to reach its target. And do its job. Now, let's move on to pharmacokinetics. Which is all about
how the drug
is
absorbed,
distributed,
metabolized,
and eliminated by the body. So it's about tracking the drug's journey. Through the body. Understanding how it
Understanding how it
gets where it needs to go.
And
how it's
eventually
cleared out. In the case of Meropenem Vaborbactam,
yes,
it's administered
intravenously.
So it enters the bloodstream.
It does.
Directly from there.
It's rare distributed widely.
For quite a body, including those crucial sites.
Of infection.
And what about it?
Its
metabolism and elimination? Is this drug?
So both Meropenem and Vaborbactam are primarily eliminated by the kidneys.
Okay, so that's why renal function is so important. When considering this drug. Right, we talked about the importance of dosage adjustment. For patients with kidney problems. You need to make sure the drug isn't accumulating in the body. Potentially leading to toxicity.
Exactly.
By understanding those pharmacokinetic principles, we can
optimize the dosing regimen.
And
ensure that the drug is reaching
therapeutic levels while minimizing the risk of adverse effects. It's fascinating to see how those scientific principles translate into practical considerations. At the bedside. Now, before we move on, I'd like to circle back to something you mentioned earlier.
Right.
The emergence of resistance to
Meropenem Vaborbactam.
Meropenem Vaborbactam.
You highlighted some concerning trends, particularly in Klebsiella pneumonia. Can you elaborate on the specific
mechanisms of resistance that are being observed?
Of course. One of the primary mechanisms we're seeing is the acquisition of additional beta-lactamase genes.
Right.
We've already discussed KPC enzymes. But some Klebsiella pneumonia strains are now also acquiring genes that encode metallo-beta-lactamases, like NDM.
So it's like they're upgrading
their arsenal,
adding new weapons to their defense system. And this is a major concern.
It is.
Because metallo-beta-lactamases are not inhibited by Vaborbacter. So if a
Klebsiella
pneumonia strain
is producing
both
a KPC enzyme
and
the lactamase.
Metallo-beta-lactamase. Meropenem
Vaborbactam
is unlikely to be effective. That's a sobering thought.
It is.
It really highlights the need for new antibiotics.
That can target
these emerging resistance mechanisms. We're in a constant race against these evolving bacteria. And we need to stay ahead of the curve. Well said. Now, as we've been discussing, the role of the medical microbiologist
is crucial
in combating antibiotic resistance. But I'm curious to hear your perspective on the future of this field. What emerging technologies or strategies do you think will be key in the fight against these superbugs?
That's a great question. And it's one that's on the minds of many microbiologists.
I bet.
One area that holds great promise is the development of rapid diagnostic tests.
What are rapid diagnostic tests?
Rapid diagnostic tests
are designed to
quickly and accurately identify specific bacteria. Causing an infection. And determine its susceptibility to various antibiotics. Traditionally, we've relied on culture-based methods. Which can take several days to provide results. So we're talking about shaving off days of waiting time. Getting those critical answers much faster. Exactly. With rapid diagnostic tests. You could potentially get
results within hours.
Allowing for
more timely And targeted antibiotic therapy. That would be a game changer.
It would
allow us to avoid those broad-spectrum antibiotics.
Broad spectrum.
That can
drive resistance.
And instead choose the most effective drug.
The most effective drug.
Right from the start.
Right from the start.
Precisely. And this brings us to another exciting area.
Okay.
Personalized medicine.
Personalized medicine, it seems like.
Go ahead.
That's becoming a buzzword.
It is.
In every area.
In every area.
Of healthcare these days.
Of healthcare.
How would it apply?
How would it?
To the fight against
antibiotic resistance.
So with personalized medicine, the goal is to tailor treatment to the individual patient, taking into account their unique genetic makeup. Their specific infection and their overall health status.
So it's about moving away from those one-size-fits-all approaches.
One-size-fits-all.
And embracing.
Embracing.
A more individualized strategy.
A more individualized.
Exactly. And in the context of antibiotic resistance.
Of antibiotic resistance.
This could involve developing new diagnostic tools.
Developing that cures and predict
an individual's risk.
An individual's
of developing a resistant infection. Or they're liking
of responding to a particular antibiotic.
To a particular.
That's incredible. It's like
what is
taking personalized medicine to the microbial level.
To the microbial.
Exactly. And this could have a profound impact on how we manage antibiotic therapy. For example,
if we could identify patients who are at high risk of developing a
resistant
infection,
we could implement preventive measures
or tailor their
antibiotic
their antibiotic regimens
accordingly. So it's about being proactive.
It is
staying one step ahead. Of those resistant bacteria.
Precisely, and this brings us to another area. That's gaining momentum. The development of new antibiotics.
Yes.
Yes.
The quest for the next generation.
Generation.
It seems like we're constantly searching for new weapons to add to our arsenal.
Our arsenal.
You're absolutely right. The development of new antibiotics is crucial.
But it's also
a
challenging,
a time-consuming process.
I
can imagine those bacteria are constantly evolving. So it's like
evolving.
We're trying to hit a moving target. Exactly, but there are some exciting developments.
Exciting the pipeline.
In the pipeline, scientists are exploring
new targets
within bacteria.
Looking
for novel ways to disrupt their growth and survival. So it's about finding those bacterial Achilles heels. Those weak points that we can exploit.
Weak points.
Precisely. And there's also growing interest
in exploring alternative therapies.
Alternatives such as phage therapy.
Phage therapy. What's that all about?
So phages are viruses that infect
and kill bacteria.
So we're talking about using viruses to fight bacteria.
Viruses to fight?
That's an intriguing concept.
It is.
Phage therapy has been around for decades. But it's gaining. Renewed interest as we face this growing threat of antibiotic resistance. So it's like harnessing the power of nature.
The power
to combat these superbugs.
Exactly. And the beauty of phage therapy is that phages are highly specific. They target only certain types of bacteria, leaving the beneficial bacteria in our bodies unharmed.
So it's a more targeted approach.
It is.
Minimizing the disruption to our gut microbiome. And because phages can evolve and adapt alongside bacteria, they offer a potential solution to the constant challenge of resistance.
So it's like having a
dynamic weapon
that can keep pace with evolving bacteria.
Evolving.
That's incredibly promising.
It certainly is. But it's important to note that phage therapy is still in its early stages of development. And more research is needed.
It's not a magic bullet, but it's
It's not.
Certainly an exciting avenue to explore.
An exciting avenue.
And it highlights the fact that we need to think outside the box.
We do.
Consider all possible solutions.
All possible.
As we face this global challenge of antibiotic resistance.
Couldn't agree more.
Yeah.
It's going to take a multi-pronged approach.
Right.
Involving new antibiotics, new diagnostic tools.
Okay.
Personalized medicine, alternative therapies, and of course, continued efforts in antibiotic stewardship.
It's a collaborative effort.
It is.
A global responsibility requires the expertise of
scientists,
clinicians,
microbiologists, and policymakers. Working together to preserve these life-saving medications.
Preserve these life-saving.
That wraps up our deep dive. Into Meropenem Vaborbactam. We've covered a lot of ground today.
We have.
From the intricacies of beta-lactamase inhibition to the real-world challenges of managing resistant infections. We've explored those crucial clinical considerations, those moments where you as a medical microbiologist are called upon to provide
your expertise.
And
guide those
critical treatment decisions.
And we've touched upon those emerging resistance trends, those challenges that lie ahead. Reminding us that the battle against antibiotic resistance is an ongoing one. A race against those ever-evolving bacteria. But we hope this deep dive has equipped a deeper understanding of Meropenem Vaborbactam.
Of its strength.
Its strengths.
Its limitation.
And its crucial role. In our fight
against
those formidable foes.
Remember, knowledge is power.
Yes.
And by staying informed, by staying engaged, by continuously seeking new knowledge, you're playing a vital role.
Absolutely.
In protecting the future of antibiotic therapy.
Thank you for joining us.
Thank you.
On this journey of discovery.
Yes.
We'll be back soon.
We will.
With another
deep dive
into the fascinating world
of
microbiology. Until then, stay curious.
Stay
vigilant.
And keep up.
And the amazing work you do.
Keep it up.